Joining me via Zoom is Ashanti Regional President of the Ghana Medical Association, Dr. Pakwesi Baidoo. Doc, good to have you on JoyNews Prime. But from where you sit, what is accounting for the many COVID-19 deaths in your region?
Sorry. Good evening to your listeners. I just tuned in, and I think I got the latter part of the interview with my regional director of health. And I share in his sentiments. The people in the region think COVID-19 is just a figment of the imagination of health workers. And that said, if you look at the latest figures, I think I have those from yesterday. And out of the total number of deaths in the country, I think 129 from my last check, 58 of them are coming from Ashanti region. And though we have the second highest just behind Accra, I think we have more deaths than Greater Accra with the highest number of cases. And then my checks, well, usually I am with them every day. So I just spoke with them today. And you realize that some of the factors accounting for this is one, of the total number of people who have died, the 58, only 10% are below 50. So you realize that most of them are above 50 years. And with that comes your comorbidities, as they usually say. But that in itself is not a reason why people die, but it's one of the main reasons being that most of the people we see here are elderly. As I said, only 10% are below 50 from the statistics we have here. Secondly, you realize that there's so much community spread. And when people are sick, just like the regional director said, they go to all manner of places or they take all manner of concoctions. Now, the medication of choice is the zinc and zinc-based products together with the vitamin C's. But then by the time they get to our health facilities, you realize that most of them are almost dead. So just like the regional director said, they present to our hospitals really sick, really, really sick. And that is what is accounting for most of the deaths within the region. The third factor has to do with the number of beds that we had in the region. And when I say the number of beds, you realize that in the region, it was only Konfanochi that was taking care of the critically ill ones. And now I think new facilities are being set up. Thankfully, thanks to Professor Frimpong Boateng, I think he's released his facility at Tuase for us to have it as one of the treatment centers. So you realize that unlike Accra, where we have UGMC, we have Ghana East, here is only Konfanochi, and some time back we talked about bed occupancy, the treatment and holding areas being full. So all these factors contribute to the high mortality rate we see in Ashanti region.
So what's the plan going forward to help deal with the situation, Doc?
Yes, it's important that the people within the region realizes that COVID-19 is not the figment of anybody's imagination. The disease is real, and just like my regional director said, this evening I was having a chat with a group of people, and I said if they want, we can invite them, because there were a group of 15 people arguing, and I chanced on them, and somebody realizing I was a doctor, and the argument was there was nothing like COVID-19. Is because probably the government needed money. That's why they created that just to obtain money. And I told them if they want, we will invite them to the treatment centers to see that no, it's not anybody's imagination, but there is real. So it's high time the people within the region realizes that it's real, and then we go by all the necessary precautions as advocated by the Ghana Health Service and all the necessary bodies.
I'm grateful for your time. Dr. Baidoo is Ashanti Region President of the Ghana Medical Association.